I at the time was the director of the outpatient pediatric practice, and we were in the midst of a construction project. And right on my desk in my office were the construction plans. And we were laying out the design for where the rooms were going to go. So we had a meeting, and I said, okay, we're going to take that room, which is right in the middle of the pediatric practice, and we're going to make that our breastfeeding and pumping room. And I proceeded to have a knockdown, drag-out fight with our business manager because she said, that is the stupidest idea. Nobody breastfeeds here. We don't have any space. We don't have the money to pay for the room, and I can't allow it. And we had this big fight, but I won the fight, and we opened up our first breastfeeding pumping room, which was located right smack dab in the middle of this very busy outpatient pediatric practice. It opened in February of 1998. We found a children's charity that actually paid for the paint and the wallpaper, and I'm sure we violated every code known to man with that wallpaper because the fire chief wanted to take it down. But it cost $2,000, and we did something. You know, we opened up this breastfeeding room. So we started this strategy. We didn't know what we were doing. Looking back on it, it was brilliant. I'd like to say we were brilliant, but we didn't know what we were doing. So we said, well, let's have a party, because we finally have done something after a year and a half of work. So we said, let's invite people over to cut the ribbon. And I've learned people will come to cut a ribbon. They don't even know what they're cutting a ribbon for. But they will come to cut the ribbon. And she was at the party. And we had no money. So 50 cents, we went and bought one of those rolls of, you know, that tape that you put around for parties. And we strung it. Those are thermometer taking devices. And we had a party. We cut a ribbon. And we went to Costco and we bought a $9.98 cake. Welcome to our breastfeeding room, and we had a party. And what was interesting was now Boston Medical Center had a new hospital newspaper, which was the first thing that we had. And so actually we got breastfeeding on the cover of our hospital-wide newspaper. Now, looking back on it, that would have been brilliant, but it just kind of happened. There was a photographer there, so we got in the news. So we regrouped in our monthly pizza meetings, and we were all full of ourselves, and we said, okay, this is awesome. What are we going to do next? And my good colleague, Dr. Debbie Frank, was sitting at a table just like this. And she raised her hand. We said, yes, Dr. Frank. She said, let's invite Lieutenant Governor Jane Swift to come down and open the breastfeeding center. And we all started laughing, kind of hitting her and saying, that's great, Debbie, but we don't have a breastfeeding center. And she goes, oh, but let's ask her anyway. And so we kind of said, oh, go ahead. You got to know Debbie. Just go ahead. You know, she'll get this out of her and we'll move on. So wouldn't you know, later on the day, she called me up, well, the Lieutenant Governor's coming to open our breastfeeding center. So the deal with this in Massachusetts was Jane Swift had run for lieutenant governor. She was pregnant with twins. So it was the maternal baby theme was in the newspaper all the time. Debbie is a friend of hers, the State House right down the road, so she said she would come. So the problem was we didn't have a breastfeeding center. We didn't have it. So we made a few phone calls and we said, we need a breastfeeding center. So they took, this is on the 5th floor where the pediatric practice is, this was a storage closet. So they said that can be your new breastfeeding center. And within days, we had people up painting it from the administration, sent these people to paint it. We had, you know, the stains in the ceiling that are there forever, that got fixed. The electrical outlet that hadn't worked for like 25 years got fixed. The windows got washed, new curtains, the place was all spiffed up. So the lieutenant governor was coming to open the breastfeeding center, and there she is in the dark dress in the middle, and we used the same roll of tape. And the head of the board, Manny Ferris, came from Arizona to cut the tape. And the hospital paid for the cake this time. And again, we got in the paper. So this was great. We were really now rolling in this breastfeeding committee. And what was most interesting, we were getting so many calls of people wanting to join the committee. They were hearing about it and they wanted to join the committee. So we said, okay, what else can we do? Let's take down the stuff Larry was giving us and let's put up posters that say we support breastfeeding. Let's actually buy books. If we have a mom who's breastfeeding has trouble, we could look into the book. We found out the books. We actually walked around again. We said, oh my God, look at right over the baby's head in that bassinet. There's a card from Larry. Larry was giving us this card for free. And if you turn this card around, it says, don't change the formula that your baby doctor gave you unless you call your doctor. So we ripped these cards up, and we came up with a new card right over the head of the baby that families would take home. And then we had to really, really work on education about the doctors and nurses. So we started a yearly conference. That's Marshall Klaus we invited to come and talk to. This is a room full of doctors that are now learning. Look at how intent they are about, they're sitting there going, I never knew that. Wow, what's he talking about? And then we started to send our nursing staff away. We've sent about 100 nurses away to that 5-day course that I went to. So this is Cheryl Lee talking to a mom and dad and helping them to learn how to breastfeed. But remember, it's not just breastfeeding. This is infant nutrition. This is her health. This is bonding of this family together. Look at this. Instead of having this baby in a nursery, look at what's going on here. Look at this dad. This dad was totally invested in this. We actually had to get Cheryl Lee in there because we had to get the dad to move away. He was so proud of this whole thing. So we did a ton of education, and I really would mean education all the time, all the time. Then we had to look at our house staff, and it became a personal mission of mine that you would not graduate from our program without getting intense, correct information about nutrition, including breastfeeding. So these were my 4 house staff, all women, and I would say after about 4 days of teaching in the beginning, they can go out and really know what they're talking about and really learn, so that this house staff is helping this teenage mom to breastfeed. And breastfeeders, teenagers in our hospital have our highest breastfeeding rates. And then the guys on the groups heard me give this talk once, and they said, that's not fair. We were on your service and we had 100% breastfeeding rate. Take our pictures, show that, let them know that guys can help moms breastfeed. So these were my house staff. These are 2 family medicine residents and 1 pediatrician. All guys on the service managing mother babies and totally doing breastfeeding. So we have this picture all over the place, and this is a really important picture. This is a drop of formula under a microscope. It's stained so you can see if there's cells in the picture. This is formula. This is 1 drop of breast milk. These are white cells. This reminds us that breast milk contains so much antibody protection. And these white things, those are the fat globules, and those contain the free fatty acids. That's why those premature babies aren't getting neck, and that's why their brains are growing better, because those preemie babies are getting those fat globules that they really need. So here's the picture. It's posted in every room. We all carry it around with us to show families, because we have to be big cheerleaders to keep moms to keep going through this. Then we worked really, really hard in terms of the consistency of our message, that we were all saying the same things about very basic principles. We changed the way we were doing the hospital system, so it wasn't a nurse for the mom and a different nurse for the baby. We did couplet care, which was a nurse for the mother and the baby, which it was the biggest fight to get this to happen. It was just a huge fight. We started to practice evidence-based medicine, so we said in our meeting, we're going to look at every issue in this hospital, we're going to take our policy, rip it up, and start over. Naively, we picked the baby bag issue. We didn't know what we were picking, but we picked the first topic, the baby bag issue. So we went to the literature and we said, should we keep giving mothers these baby bags that Larry is giving us? And the baby bags they're really nice. You see moms carrying them around. They have the logo on them. Inside they have free packets of formula that we were giving to moms when they were walking out of the hospital. Larry was giving them to us for free. We were giving them to the families. And we said, should we keep doing that? So we went to the literature, and unbeknownst to us, there were 5 very well done studies that all showed the same thing. Even if you take the formula out of those bags, if a doctor or a nurse hands that bag to the mother, she will be a less successful breastfeeder. So we said we're going to go by the evidence, so we stopped giving out the bags, and huge, huge controversy at our hospital. We came up with our own bag that we're paying. Initially, we paid for it through the charity, and then we found the nursing budget now pays for it. So it's viewed at our hospital as a good marketing tool to have brand new moms walking around. We had to look at the pacifier issue, which I shared with you. That was a big fight. I won't go through that. We had to learn about feeding choice. Pregnant women make their feeding choice very early on in pregnancy. I mean, once we get them and the baby's out, that's quite late. So it's very early on. So we really had to get our OB colleagues involved in this, which was a struggle, because they're surgeons and they're wonderful surgeons, but they have a surgeon mentality. So it took us a while to get them involved, but they did eventually and were great. Then we had to look at this whole thing about the baby's born and we want the mother and the baby to stay together. So we had to try to change our whole system of baby's born, go to the box. We had to try to keep them together. And then the whole rooming in issue, we were doing pretty good with this. So this is Maria, who is our nursery nurse. That's our box at our hospital. And you can see that she brought in a book to read, because there's nobody in our nursery usually, because the babies are well and they're with the mother.